Can you hear me? Hello?
Yes, hello, Michael. We can hear you.
Can you see my screen?
Yes, and we can see your screen as well.
Okay, good. All right, my name is Michael Batame. I'm a graduate from the University of Ghana, and I'm pursuing my master's degree at the University of Twente in the Netherlands.
Michael, maybe a little bit of volume will help.
Okay.
It's a bit low.
Okay, sure. I said my name is Michael Batame. I'm a graduate from the University of Ghana and currently doing my master's at the University of Twente in the Netherlands. And I'm one of the authors for this abstract. So the topic is emerging adult attitudes and perceptions towards ultra-processed foods, fruit and vegetables consumption in a Ghanaian university foodscape. And in the order of presentation would be background, objectives of the study, the methodology, the key findings and conclusion, and the questions. Now with the background, the dietary choices we make affect our health and have consequences for the environment, both of which have serious implications for the 2030 Sustainable Development Agenda. The emerging adults are less likely to meet standard healthy diet recommendations, and however, emerging adults would present an opportune period to influence the adoption of the healthy lifestyles. So the study sought to examine the emerging adults' knowledge and attitude towards ultra-processed food, fruit and vegetable consumption among emerging adults, university students in urban Ghana. Also, we sought to explore the influences shaping the consumption of ultra-processed food, fruit and vegetables. And lastly, to determine the barriers or the facilitators to the adoption of the healthy standard diet in the university food environment. So with the methodology, the research design was qualitative research where we used semi-structured interviews, and we interviewed a total of 46 students, and with a mean average of 21.2 years. Out of the interviews we did 8 pair best friend pair interviews and 7 focus group discussions. And the study area was the University of Ghana main campus. And we used the Nivovo version 12 to analyze the data. With the key findings in terms of knowledge, the study identified that there was a significant gap in knowledge of dietary guidelines were identified as most university students were unaware of the WHO recommendation for fruit and vegetables intake. Also, in terms of perception, students had a perception of that healthy is expensive, and fruits and vegetables were seen as festive occasion where we eat it. So according to one of the interviews organized, one of them said, fruit is like Christmas occasion, then I'll just go in for it. And when I'm getting lunch, I know I am supposed to eat something heavy. But yeah, so with the second key findings in terms of the food choice determinants, we saw 3 interwoven levels of influence shaping emerging adult food choices were identified. That are the intrapersonal, societal, and environment factors. So when talking about the main factors affecting in terms of food-related choices students made on campus, we saw 1, the food price. So the food price was very important as students were really concerned about the financial status before opting for a food to buy. So one of the interviewers said, I want to eat and feel full. When I buy more carbo, I get filled up easily compared to fruit. If you eat the banku, it can take you throughout the whole day. If I have more money, I would try and even balance them, probably get more fruits. That was one from another person. So in terms of the second determinant of food-related choices, another one was normative beliefs and social modeling. So students learned their food norms at home. So once they get onto campus, the peer pressure and the campus food norms disintegrate their norms they had. And one of the interviewers said, my mom doesn't eat pork. So growing up, there wasn't pork in the house. I started taking pork when I came to the university. And like my friends used to say, pork is so nice. Why haven't you? So I tried it and I realized it was really nice. And in terms of convenience of access, students tend to buy things that were closer to their hall of residency. And another person here said, in how long have I waited to count? Some places, you wait for a very long time. A lot of people don't like cooking, so there are a lot of people there, so you would wait for a very long time. And in terms of the other determinants of the food-related choices, there was craving, and the study saw it as a very important personal level factor more than their health. And this was influenced by the campus food norms. And in terms of sustainability and health, we realized that environmental sustainability was never considered, and health and nutrition were secondary matters to the students. Many of them haven't heard of sustainable development through the interviews we organized, and some also misunderstood it for environmental sustainability. And I read one of the interviews. Considering environmental sustainability, I don't really think about it when I go out to buy food. And another person here also said, health and nutrition. I know it is bad, but because I don't see what goes on inside it, it is not really on top of my list like that. And in terms of dietary behaviors, the study found out that students were skipping most of the dietary behaviors. They adapted dietary behaviors like skipping breakfast, taking intake of fatty foods, snacking on pastries, sugar, sweetened snacks, and beverages. There were low intake of fruit and vegetables, and late night eating. One of the interviewers made mention that I mostly have 7:30 class, so mostly I skip breakfast, which is very bad, but I mostly skip breakfast. Another one also said, oh, I don't remember the last time I had a fruit. Well, then lastly, the last interview I will take is fruit and vegetable. Only when I am having a health problem that needs fruit, then fine. After it passes, then I'm done with fruits or vegetables until the problem resurfaces. Then next, so in conclusion, in the absence of national dietary guidelines, significant lack of awareness of who dietary guidelines and the connection between dietary behavior and sustainability, they were not important influences on emerging adult food choice. So research on effective tailored interventions to bridge these gaps are urgently needed. Lastly, health promotion in the study country should take advantage of the opportunities offered by the university system to impact emerging adults' health behaviors. Thank you for your attention.